If you are over 60 and wear a Clonidine blood pressure patch right now, stop and listen. This is not a routine recall. In April of 2026, the FDA pulled a major batch of Teva Clonidine transdermal patches off pharmacy shelves after finding a contaminant that should never sit pressed against your skin for an entire week. What they found is the part nobody is talking about. Once you hear it, you will never look at transdermal medication the same way. If you have one on right now, do not panic, do not yank it off, and stay with me. I am going to walk you through exactly what to do tonight. I'm Dr. Richard James. After years of helping older adults navigate medication safety, I have seen how a single contaminated batch can quietly affect tens of thousands of people before anyone connects the symptoms back to the drug. A Class 2 recall sounds reassuring. It is not the highest tier. The FDA defines it as a product that may cause temporary or medically reversible harm. That sounds manageable. Here is what most people do not understand. A Class 2 warning in someone over 60 carries the practical weight of a Class 1 in any other age group. Your liver clears toxins more slowly. Your kidneys filter at a fraction of the rate they once did. The same exposure a 35-year-old shrugs off in 48 hours can sit in your tissue for a week. 3 things should worry you right now. The first is independence. An uncontrolled blood pressure event in someone over 60 is one of the fastest paths to losing the ability to live alone. The second is silent damage. Your patch may be delivering a contaminated dose right now, and you would feel almost nothing until the cumulative effect crosses a threshold. The third is the gap in the system. Most prescribers do not yet have this recall notice in their inbox, and the follow-up calls to patients are happening unevenly. The way this drug enters your body makes that contamination roughly 10 times more dangerous than if it were a pill you swallowed. I am going to explain exactly why in just a few minutes. Pull up your patch box right now if you have one. Look at the lot number printed on the side. Check the manufacturer label, the strength, and the batch range. The FDA publishes the affected lots on their enforcement reports page. This is the moment to put eyes on your actual packaging, because pharmacist callbacks have been uneven. Here is what the FDA actually flagged. The recall centers on a problem with the chemistry of the patch itself, not just the active drug. Transdermal patches are not simple stickers. Each one is a layered system. There is a backing layer. There is a drug reservoir or matrix. There is an adhesive. There is a release liner you peel off. Every one of those layers is in contact, directly or indirectly, with your skin and with the drug. The contaminant identified in this April 2026 recall sits inside that layered system. It is not the active Clonidine doing what Clonidine is supposed to do. It is a separate chemical impurity that was not part of the patch's approved composition. Your body has been absorbing it through your skin every hour, around the clock, for as long as that patch has been on. Here is the part that catches most people off guard. A pill goes through your stomach, then it passes through your liver, then it enters your blood. Your liver is your filter. It removes a significant percentage of impurities right at that checkpoint, before anything reaches the rest of your body. With a transdermal patch, that filter is bypassed completely. Whatever is in that patch, the right substance or the wrong one, goes directly into your bloodstream. That fact alone is why transdermal contamination is a different kind of problem from a contaminated pill. I want to give you something concrete. If you have been feeling weirdly off in recent weeks, more tired than your sleep should explain, dizzier when you stand up, your home blood pressure log looking more erratic than usual, you are not imagining it. That is the kind of pattern that prompts a clinician to start asking which medications might be involved. And right now, this patch needs to be on that list. If you cannot find your lot number on the box, look at the prescription label your pharmacy applied. The patch packaging itself sometimes has the lot printed near the corner of the foil pouch. If you used mail order, check your shipping invoice. Take a photo of whatever you find. You will need it when you call your prescriber. Now, this next part is the one I lose sleep over as a clinician. What they found inside the patch is only half the danger. The other half is how the patch delivers that contamination into your body. The pharmacology of transdermal absorption is doing something to your exposure that nobody is talking about in the news coverage, and it changes the entire risk picture for adults over 60. Think of your liver as a security checkpoint. Every pill you swallow has to clear that checkpoint before reaching the rest of your bloodstream. The liver removes a portion of impurities, breaks down compounds, and decides what is safe to circulate. Pharmacologists call this first-pass metabolism. It is one of the body's most important built-in protections, and for most oral medications, it is doing real work every time you swallow a pill. A transdermal patch skips the checkpoint entirely. That is not an accident. That is the entire design principle. Patches were invented for drugs that get destroyed by stomach acid, or that get filtered out too aggressively by the liver. They work brilliantly when the drug is exactly what it is supposed to be. When something else slips into the system, that same design becomes the problem. The patch does not know the difference between the medicine and the impurity. It delivers both, continuously, for the full wear time. The second piece of this is what most people never hear about. Your skin changes after 60. We tend to think of older skin as drier, thinner, more fragile, and all of that is true. The textbooks of clinical pharmacokinetics also document something else. The outer skin layer, the stratum corneum, becomes more permeable to certain small molecules with age, especially when the skin is occluded by an adhesive patch for days at a time. The skin under a clonidine patch is hydrated, warm, and slightly broken down at the cellular level by the constant occlusion. That environment makes absorption faster than the original patch testing assumed for a younger volunteer. So an older adult wearing a contaminated patch is doing two things at once. They are bypassing the liver, the body's main filter. They are also absorbing more per hour than the patch was designed to deliver. That is the roughly 10 times problem I mentioned at the start. The exact multiplier depends on the person, the contaminant, and the skin condition. The principle does not change. Let me give you an example I have seen the shape of more than once in clinic, framed as a representative profile. Picture a 73-year-old retired school teacher. Let us call her Carol. Her blood pressure has been beautifully controlled on a clonidine patch for 18 months. In the last 6 weeks, her home readings have started swinging. Some mornings they are 122/78. Other mornings they are 158/96. She blames the salt in her dinner the night before. Her grandson visits and notices she seems a little less sharp. Nobody connects it to the patch. That is the kind of presentation a clinician would plausibly see, and it is the kind of presentation this recall is built to alert us to. Now, the good news is that the human body is remarkably good at clearing this kind of exposure once the source is removed. The kidneys clear most of these compounds within days to weeks. The liver upregulates within a similar window once it has the chance to do its job. You only get that clearance if you actually remove the source. Leaving a contaminated patch on for one more cycle, hoping the news is overblown, is the exact mistake that turns a manageable exposure into a real medical event. This is the part that frustrates me the most as a doctor. The pharmacology is not new. It has been in textbooks for 30 years. The recall protocols still treat a transdermal contamination event the same way they treat a contaminated pill. The two are not the same problem at all. But here is where it gets really concerning. Even if you took the patch off tomorrow morning, the story would not be over. There is a second kind of damage from this exposure that looks nothing like a drug side effect, and it is the part you will never connect back to the patch unless someone walks you through it. There are 3 specific patterns I want you to watch for. Each one looks like ordinary aging on the surface. Each one is something a contaminated transdermal patch can be quietly producing. Most viewers will recognize at least one of these in themselves, or in someone they care for. The first one is the easiest to spot. Look at the skin under where your patch sits, or under where a recent patch was sitting. If you see redness, mild swelling, a darker patch of skin, or a rash that does not fade within 24 to 48 hours of removing the patch, that is your skin telling you something specific. It is not always the active drug doing that. The impurity the FDA flagged can be a direct skin irritant in its own right. Mild and short-lived local reactions are normal. Persistent, spreading, or darkening is not. If a photo from 2 weeks ago shows the same redness as today, that is data your prescriber needs to see. The second one is harder to see, and it is the one that catches even careful patients off guard. Pull up your home blood pressure log from the last 4 to 6 weeks. If you do not have a home log, look at the readings your pharmacy or grocery store machine printed for you. Look at the pattern. If you see swings of 15 or 20 points up and down where the readings used to sit tight, if you see middle-of-the-day spikes you cannot explain, if your morning numbers and your evening numbers stopped agreeing, That is the inconsistent dose release I described earlier showing up in your real numbers. A working patch should give you smooth, predictable readings. A patch with a delivery defect can give you a roller coaster that looks like it must be your salt intake, your stress, your sleep, anything but the patch. The third one is the one most people would never connect to a blood pressure patch. It shows up in routine blood work and in small daily changes you might attribute to age. Watch for unexplained ankle swelling that does not match your fluid intake. Watch for changes in how often you urinate at night. Watch for subtle shifts on routine basic metabolic panels, the kind of blood work your primary care doctor runs once or twice a year. The kidneys and the electrolyte system are exquisitely sensitive to chemistry that does not belong in the bloodstream, and they are often the first quiet alarm. I want to be honest with you here. The skin reaction signal is well documented. The blood pressure swing signal is well documented. The kidney and electrolyte signal is what I would call clinically plausible and worth watching for, not a confirmed certainty in every exposed person. Why does this matter for you personally tonight? If you have any of those three patterns, and you have been on a clonidine patch in 2025 or 2026, that information belongs in the conversation you are about to have with your prescriber. Bring the photo of the skin site, bring the blood pressure log, bring the lab results if you have them. Now the good news. The body forgives more than most people realize. Remove the source. Watch the patterns. Get the appropriate replacement medication in place quickly. Most of these signals fade. Some fade in days. Some take a few weeks. You can act tonight, you can call tomorrow morning, and you can put yourself back on the right side of this within 7 to 14 days. Stay with me because this next part could save you a hospital visit. I am going to give you the exact 3-step protocol to follow tonight, and the one mistake almost everyone makes when they hear about a drug recall. Now, I know what some of you are thinking. If I stop my clonidine cold, my blood pressure could rebound, and that could be worse than the contamination. You are right to think that. Clonidine has a well-known rebound risk if it is stopped abruptly. That is exactly why the protocol I'm about to give you is not stop and wait. It is remove the patch, then talk to your prescriber this week, not next month. For the people thinking my pharmacist would have called me by now, here is how recall notifications actually move. They go from manufacturer to distributor to pharmacy first. The patient call happens last and depends on how your specific prescription was logged. If you ever refilled at a different pharmacy, used mail order, or had your prescription transferred between systems, you may not be on the call list at all. Checking your own packaging is the only reliable way. Here is the 3-step protocol. Step 1. Tonight, remove the patch. Place it inside a sealed plastic bag on its release liner if you still have it. Pharmacies will accept it back for safe disposal and lot tracking. Step 2. Within 24 hours, check the affected lot ranges on the FDA Enforcement Reports page against your packaging and your refill history. Call your prescriber's office and use this exact phrase. I am calling about the April 2026 Teva Clonidine patch recall. I have removed my patch. I need a same-week plan to maintain my blood pressure safely. Those sentences cut through phone tree friction faster than any general request. Step 3. Within 48 hours. If you own a home blood pressure cuff, take a reading every morning and every evening. Write them down. If any reading goes above 180/110, or if you have severe headache, chest discomfort, or vision changes, treat that as an emergency and call 911. Do not wait for the prescriber callback. Here is the part I want you to take with you. Beyond this one recall. Transdermal patches deliver drug into your body around the clock for days at a time, completely bypassing your liver, on skin that absorbs more readily after 65 than the patch's original testing assumed. That is true for every patch on the market. Blood pressure patches, hormone patches, opioid patches, nicotine patches, motion sickness patches. Every one of them shares the same fundamental delivery profile, and every one of them depends on the manufacturing being clean. What this April 2026 recall reveals is not just one bad batch from one company. It is a reminder that the regulatory system for transdermal products still treats contamination the same way it treats contamination in pills, when the underlying pharmacology says these are very different problems. The system is good. It is not perfect. After 60, the margin for error narrows, and a defect that would barely register in a younger body can take weeks to clear from yours. You are the most reliable safety net for the medications going into your body. That is not me being dramatic. Pharmacists are stretched thin. Prescriber inboxes are overflowing. Recall notices move through the system at the speed of paperwork. The one person guaranteed to see your medication every single day is you. So the next time you or someone you love is prescribed a patch, any patch, ask your prescriber 2 questions. 1. Is an oral version of this drug available? And is it equally appropriate for me, given my age and my skin condition? 2. What is the lot number on my prescription, and how will I be notified if it is ever recalled? Those 2 questions take 30 seconds to ask. They could spare you the exact situation we just walked through. This is the conversation I have with my own family members when they are prescribed a patch for the first time. The conversation does not assume the worst. It just makes sure the question gets asked. I'm Dr. Richard James. If this video helped you understand something nobody had explained before, including possibly your own pharmacist, share it with anyone you love who is on a patch. Any patch. The questions I gave you tonight apply to all of them. Subscribe because next week I am covering the opposite side of this same story. The patches that are actually safer than their pill versions for older adults, and the exact way to know which is which before you accept a prescription. Take care of yourself tonight. Go look at your patch before bed. Check the lot number. Take that photo of the skin underneath if anything looks off. Your body has been letting you trust it for 60, 70, 80 years. Tonight is one of the nights it needs you to return the favor.